So you want it to be very snug so that the baby is supported. The second thing you want to do is that the baby needs to be in your view of all times. And when we say in view at all times, especially with newborns, we need to make sure that you can see their face. This lets us know that their airway is clear. We don't want them, and this is the second one, that they should be close enough to kiss. So the next three kind of tie in. So they should be in view at all times. You should be able to see their whole face. They should be close enough to kiss. So if you just tilt your head down, you should be able to kiss the top of their forehead. That means they're up high enough, not sinking down into your body or sinking down into the carrier, because we want to prevent the third thing, which is that they are keeping their chin off their chest. As a public health worker, this is something we teach in a lot of different things. We don't want babies chin to chest in car seats. We don't want them chin to chest in strollers. We don't want them chin to chest in a baby carrier because it closes off their airway and that can cause positional asphyxiation. So when we hear about some of these SIDS cases, or when we hear about babies having, premature demise, is because their chin has cut off their airway. They're not able to breathe and get air. And with newborns, this is especially important because they don't have the neck strength to pick their heads back up. A little bit less of a concern with an older baby, not a concern generally with toddlers. Because if, an older baby or a toddler feels themselves not being able to breathe, they'll wake themselves up. They'll sit up and readjust. But with newborns, they can't do that. So we, as the parent, as the wearer, have to be checking to make sure if they start sinking down, because that's a normal thing for babies to do. They kind of start curling in and tucking in. Totally fine. They get cozy and snuggly, but we want to make sure that we kind of tilt that head if we need to, tilt that chin up if we need to. If we're wearing a carrier and we've been moving a lot, that we check the fit again really quick, making sure that the baby's up high enough that we can kiss their forehead without having to lift them up or bend down too far and hurting our necks, making sure that we feel comfortable in the carrier in our body, because sometimes the weight of the baby will start creating pressure points as well. So we want to make sure that, if you've been wearing for a long time, that we just do a periodic fit check, make sure everything's still where we want it to be. One, to ensure the baby's safety, and two, to ensure both the parent and the baby's comfort. And then the last thing is the S. You want to support their back. You want to make sure that the baby's back is supported at all times. In the baby wearing world, there are two different types of kids that we talk about, 10 more as older babies and toddlers, but supporting the back is important all the way through the baby wearing spectrum.